Prognosis, well, it's degenerative condition, so it really depends on the location. If it's over the joint, the prognosis isn't as good as if it's far away from the joint. Splints, these are a common one. What are they? Well, the two metacarpal bones at the back and either side of the cannon bone. Damage to the attachment of the splints to the cannon causes swelling, inflammation, sometimes fracture. Occurs on the inside or the outside of the cannon. It's more common in horses between the ages of 5 and 7 when the splint actually lose their flexibility and elasticity. Normally due to some form of trauma, the horse can knock itself. Signs and symptoms: swelling, heat, pain, lameness. Treatment: ice rest surgery. Prognosis is normally good. I think that most days I go out and treat horses, I will see at least 1 or 2 horses with splints. Really common, yeah. No, just literally an ice pack. Yeah.
That's surely nice and effective in the swelling stage.
Absolutely, in the acute, yeah.
But once it's formed, you're saying the only really, if you want to do anything about it, surgery.
Yeah, you wouldn't bother though. No. Arthritis. Here's a common one in people and becoming more, not so much prevalent, but more probably spoken about in the horse world. What is it? Well, it's very similar in horses to what it is in humans. It's a wearing away of cartilage on the articular surfaces, generally in the weight-bearing joints of the legs and hooves, the knees, shoulders, joints, neck, fetlock, hocks, back and stifles. Occurs in older horses, as it occurs in older people. Causes, mainly the ageing process. The signs and symptoms are what you would expect with people: stiffness and reduced range of movement. The treatment is generally management, painkillers if need be, a low dose, probably towards the end of the day. Sprained flexor tendons. There's 2 of them. The superficial and the deep flexor tendon. They're damaged due to overextension of the forelimbs. Occurs quite commonly in racehorses, but any horse exerting itself at the canter or the gallop. Signs and symptoms: lameness, swelling, puffiness, localised puffiness. Treatment: rest, bandaging, remedial shoeing. So you can see so far there seems to be a bit of a common treatment pattern with a lot of these musculoskeletal problems. Yeah. Okay. Okay, sprained suspensory ligaments. Now, I'm not too sure how well your picture comes out, but this horse I actually saw a couple of weeks ago, the one on the right. Overall, it moved very, very well, but it was quite shocking seeing this. So, what are they? They're strong, broad, fibrous structures that attach to the back of the cannon bone, just below the knee. About 2/3 of the way down, they divide into 2 branches which attach to the inside and outside sesamoid bones on the back of the fetlock. Injury to the upper third is common in all disciplines. Injury to the middle third is less frequent. Damage to the inside or outside is common in jumping horses because of the actual twist as the legs come up. As I mentioned, so dressage jumping, national hunt and point-to-pointers, it's quite common in. Signs and symptoms, again, heat, lameness, well, dependent on the severity and the location. It's not always easy to diagnose, so often the vet needs to nerve block it. Unfortunately, treatment normally involves box rest and can be quite a long time. A capped hock or elbow. Now, I see the equivalent in human practice quite a lot, and it's normally due to a thing called bursitis. Bursts are pads of fat that you have over all joints, and horses have them over theirs as well. So this pad of fat is by the joint, and its job is to actually take the trauma before the joint takes the trauma. So a capped hock or a capped elbow means essentially bursitis at this area. Occurs in any horse, normally from knocking themselves, so perhaps they've travelled in a horse box badly, maybe they've got cast. Some horses actually, when they're in their stable, they tend to stand in their banks and then their hocks are just leaning up against the wall, so you end up with almost a pressure sore.
How's making
Yeah, absolutely, absolutely. Um, Signs and symptoms, again, swelling and heat, but only in the acute stages. Longer term, it just becomes cold and puffy. Treatment can be cold therapy, that's ice hosing. Aspiration, so essentially suck the fluid out. Yeah, yeah. Yeah.
Futile thing to do, really.
Yeah, pretty much. Non-steroidals and steroids. A thorapin. So this is swelling of the tendon sheath around the deep digital flexor tendon as it passes over the hock. Occurs in any horse with poor conformation, young horses who are weak behind, or horses in heavy work. Signs and symptoms, as we've mentioned before, swelling. Treatment is not normally required. If severe, you'd aspirate it. Perhaps change the work levels so there's less stress through the hocks. Look at the surface that you're riding your horse on. Instead of taking out hacks on the road, perhaps go on softer ground. Suck the fluid out. Yeah. Wingles. These are a swelling of the digital tendon sheath over the back of the fetlock joint. Signs and symptoms. Well, they're common in working horses and generally asymptomatic. As I said earlier about seeing splints in a lot of the horses that I see most days, I see wingles in a lot of the horses I see most days. And generally, it's not a lot to worry about. Although confusion can arise here because similar signs can be seen associated with damage to the superficial or deeper digital flexor tendons. So it's worth getting the vet out to ultrasound scan it. Yes. Yeah. Yeah. This morning working, I think I saw 5 horses and I was like, why is it every single one of them's got wingles? And I thought, is it because I'm thinking about my talk later? And then I was like, no, it's because most have got it. Navicular. So, what is it? It's a combination of soundness problems in horses. It most commonly describes an inflammation or degeneration of the navicular bone, which is the bone at the bottom of the leg, and its surrounding tissues, usually on the front feet. It can lead to significant and even disabling lameness. There's no single known cause, but several primary factors. Compression of the navicular bone under the deep digital flexor tendon and the back of the small pastern. Cartilage degeneration, cartilage erosion, change in bone density, ligament tension or damage and reduction of blood supply, ligament exostosis. Now, an exostosis is when, in fact, let me just go back a step. Ligaments attach bone to bone. So if you've got bone here, a ligament would go across like that. Now, if you have undue tension on that ligament, the ligament can actually pull off, and with it, it pulls a bit of bone away from the end of the joint. You then end up, or can end up, with a bit of bone floating around in the joint. Contributing factors: poor conformation, incorrect shoeing, a high workload, being overweight. Signs and symptoms: heel pain, toe first landing, initially mild lameness, stumbling, lameness switching from one leg to the other, changing shape of the feet. The treatment: remedial shoeing, going barefoot. That's becoming more and more popular. And in fact, it's quite popular with a lot of the school ponies here. Exercise less intense, painkillers, surgery. Prognosis, well, it depends. Laminitis. What is it? It's a painful inflammatory condition of the lamina of the hoof wall. It's traditionally considered a disease of fat ponies, but it can be triggered by a variety of metabolic or physical causes in any horse. So the most common causes are excessive intake of grass, sequelae to infection, sequelae to administration of excessive dosages of certain drugs such as steroids, enlargement of the pituitary gland. Less common causes include concussion from riding on hard surfaces, excessive weight bearing, stress from long-distance transport. Signs and symptoms: a strong bounding digital pulse, a hoof that's hot for hours, a distorted hoof shape and/or unusual rings, an increased heart rate, too little or too much foot lifting, apparent stretched and/or bleeding lamina, shortened stride, increased insulin levels, obesity, diarrhea, infection or inflammatory response. Treatment: get the vet. But you're looking at painkillers, box rest, deep bedding, remedial shoeing, frog supports, surgery. Okay, so that's probably a little bit hard going. Let's go on to something that's hopefully a little bit easier. Within the horse world, there seem to be a lot of terms that people use, and I think some of them are quite old-fashioned terms. So I thought I'd just go through a few and explain the meaning of them. If we start with one that's quite common, action. What does it mean? Well, simply, it's the movement of the horse's legs. How well do they move? Back at the knee. It's a conformation fault in which the foreleg is bowed back at the knee. It's more serious than over at the knee because it places additional strain on the tendons running down the back of the lower leg and more concussive forces to the front of the knee. Bandy-legged. That's pretty obvious, isn't it? Hocks turning outward. Bone. You might hear people say, how much bone has a horse got? Well, it's the ratio of the bone to the horse's weight. The measurement is taken around the leg just below the knee or hock, and the ratio determines the horse's ability to carry weight. Therefore, a light-boned horse will be limited in his weight-bearing capacity. A bowed tendon is the strain of a tendon. Usually refers to the superficial digital flexor tendon, which runs down the back of the lower leg. Brushing. We've heard of brushing boots. Brushing is where the hoof or shoe hits the inside of the opposite leg at or near the fetlock, usually caused by poor conformation or action. Buck-kneed. A conformation fault in which the foreleg bows forward at the knee. Cannon bone. You know what that is. Cow hocks. Condition in which the hocks turn in like those of a cow. Cross-firing. It's a condition in which the hind foot strikes the opposite front leg or hoof. Degenerative joint disease. It's a term for a group of disorders resulting in progressive deterioration of the articular cartilage of a joint accompanied by bone proliferation around the joint margins and thickening of the soft tissue of the joint, also called degenerative arthritis or osteoarthritis. Diagonals. I'm sure your instructors have told you about getting on the correct diagonal. The horse's legs move in pairs at the trot, called diagonals. The left diagonal is when the left foreleg and right hind leg move together. The right diagonal is when the right foreleg and the left hind leg move together. A dipped back. It's an unusually hollow back between the withers and the croup. Can occur as a result of ageing. You might also hear people say that the horse has got a weak top line if he's got a dip back, and it could be due to poor abdominal tone or poor hip flexor strength. Sorry? Yeah, a weak top line, so it would be a weakness along generally the erector spinae, but also it can be the abdominals. So as the abdominals sag, you end up like this. Yes. Dishing. A faulty action where the foot of the foreleg is thrown outward in a circular movement with each stride. Flat-footed. This is common in people. It's quite common in horses as well. Normally involves a lot of work by the farrier to get it correct, but it occurs when the hoof is at less than 45 degrees. Forging. Fault in the gait, which occurs when a hind foot strikes the bottom of the front foot on the same side. Going short. Now, this is something that I say to people a lot when I'm looking at their horses. You know, so I'll be saying that they're short behind, or they're short in front, or short through the shoulder. It's essentially taking short steps. It is indicative of lameness, but it's often due to a problem higher up. So it could be shoulder, it could be withers, or back. But hopefully when I talk later through an actual examination, you'll start to get what I mean by that. Hocks well let down. It's a term used to indicate a horse that has short cannon bones, which is considered to be a good conformational trait, giving the horse strength in the legs. Interference. It's a faulty gait in which a foot strikes the fetlock or cannon of the opposite foot, most often done by base narrow, toe wide or splay-footed horses. Knock-kneed. That's pretty obvious, isn't it? Lameness. A defect detected when the animal favours the affected foot when moving or standing. The load on the aiming foot in action is eased, and a characteristic bobbing of the head occurs as the affected foot strikes the ground. Well, I don't entirely agree with that. That's normally where you start in a lameness workup. You look for which foot is hitting the ground as the head bobs, but it's not often the cause of where the lameness is coming from, so that's a bit of a generalisation. Nerve block. You've probably heard of the vet coming out and nerve blocking your horse. This is when they block the nerves of the hoof and leg in order to determine the location of lameness. Open behind. Faulty conformation in which the hocks are far apart and the feet close together. Overreaching. A faulty gait in which the hind foot steps on the heel of the front foot on the same side. Occurs most commonly when the horse is galloping or jumping. Paddling. Throwing the front feet outward as they are picked up, most common in toe-narrow or pigeon-toed horses. Yeah. Pigeon-toed, that's pretty obvious. Sickle hocks. Hocks which are bent, giving the hind leg the shape of a sickle, with the hind legs too far under the body. Sound. Free from lameness or injury. Splints we've gone through. String halt. Condition characterised by the overflexion of the hind legs, in which the leg often is jerked up towards the belly at each step. It's thought to be neurological in origin.
I had one this week.
Yeah.
Leg.
Yeah. Yeah. It's weird, isn't it? Yeah. Tied in below the knee. The conformation fault in which the circumference of the cannon bone directly below the knee is substantially less than that above the fetlock. This goes along with bone, so this would be a horse that's got little bone. Unsoundness, a term used to describe any condition or conformation fault that limits the horse's ability to perform his job. May include conditions of the muscle, bones, heart, lungs, or other organs. Okay, so now we're away from anatomy. Now I can get on to something that is a lot easier for me to chat about. What exactly does a session with, an equine osteopathic session with me consist of? Well, during a consultation, the animal is checked from the hooves upwards and from the nose to the tail, so it's all-encompassing. A typical appointment will run like this. A detailed case history will be taken in order to find any previous injuries or illness that may be responsible for the pain or discomfort in the horse. A visual examination will be carried out, which involves walking, trotting and circling the horse in hand. An examination will then take place which involves evaluating the whole animal, including joints and muscles. The area of pain and root causes treated. The important thing here is you must get veterinary confirmation before I come out and look at your horse. I can't touch it without. It's legal. Veterinary Surgeons Act, unless you get... I normally ring the veterinary practice and check that it's okay. Some practitioners email, but yeah, you have to. Yep. Anything.
That's not the same for people who do soft tissue, is it?
I suspect it would cover them. I don't know how many masseurs do it. I do it with every horse. I think I've only ever come across one owner who refused to get the vet's confirmation, and I then refused to treat it. So they weren't very happy, but everybody else is happy to do it. I don't think I've had a problem with a vet yet.
So So what does that actually involve? Does that actually involve going to the vet vet saying, I'd like David to come out and see one, and that's it?
Yeah.
The vet doesn't have to come out and see the horse and then approve it.
No, that's fine. But at the same time, I will have rung the practice and said, I'm David, I'm the
So you
osteopath.
usually do it?
Yeah, both. I want us both to do it. And then I make notes on my notes that I've done it. I have to cover my own back, I'm afraid. Okay, so the case history. What does the case history consist of? Well, basic questioning. How long has the horse been owned? What level of work is the horse doing? How long has it been doing that? What's expected in the short and long term training-wise? What's the value of the horse? Now, that's a funny question to ask. My insurance covers me up to 5 million, which I've never seen a horse valued at that, but I did see one valued at 170,000 a couple of months ago. That was a show jumper, and that was a very nice horse, and I was extra careful with it. So I then move on to the reason that I'm there, finding out exactly why I've been called out. So have I been called out by the owner, the rider, the groom, the trainer? What is it that they think is wrong? What are they seeing that doesn't quite add up in their mind? How long has the problem been there? When is it noticeable? Have they had anybody else look at the problem? Have they actually called the vet first and the vet couldn't find the problem or prescribed painkillers, or they had another therapist out, a masseur, a physio, a chiro, something else? Has the saddle been checked? Now, I'm quite a stickler for this with saddles because I think it's important. I see quite a lot of horses that are worth a fair amount of money. People have then spent a lot of money on a saddle, 500, 1,000, 2,000, 3,000 pound on a saddle, and they don't get their saddle checked every 6 months. These are people doing dressage on their horses, and their horses change shape. Imagine if you went to the gym every day, you're going to change shape. You might get bigger, you might get smaller, your clothes are going to fit differently. So it's so important to get the saddle checked. I often speak to the saddler beforehand and after to see what they feel about it. Has the farrier checked its feet? If you think about what a farrier does, they spend, let's say, 45 minutes or an hour shoeing a set of 4, and they're going to pick up shoulders, and they're going to pick up hind limbs, and spend a long time with that leg up there. How do they find the experience of doing it? Is the horse in pain? Is it comfortable? Is it stiff doing it? So again, I often speak to farriers because I just want to pick up bits of information. And once you've found out these bits of information, once I then go and examine it, I often go, oh, well, I've got a pretty good idea of where the problem is. So I wouldn't need to ask the horse if they talked, if that makes sense. Past medical history. Has the horse had any accidents, illnesses, operations? These things might have a bearing on why the horse is presenting with a particular problem. So, onto my fees, which is, I imagine, something that most people want to know. How much do I charge? Initial consultation and treatment is £75. That consists of case history, active and passive examination, treatment, a report of findings to the vet, and a treatment plan. Follow-up sessions are £65 and will also consist of exercises normally emailed to you, or in fact I often WhatsApp people exercises now, it's easier. The other service I offer, which is probably of interest to a lot of you and is becoming popular, is horse and rider video analysis. So this consists of initially a postural analysis of you. So I come out and I take photos and videos of you from the front, from the side, from the back, and moving. I then actually see you ridden, and again, photos and videos of you. I go away and I do an audio and a written report of my findings, which I email to you, and I send you exercises on how to improve your posture and hence how to improve your riding. The last bit of it is a thing called a lean screen assessment, which is where I test your average body fat, your body mass index, and your waist to hip ratio and compare you to the normal. Right, I think in your handouts, you've got some copies of an example form that I did about a month ago. Now, this girl is a girl called Sammy, and she rides up to about Grand Prix. She's, I think she's 25 or 26. She comes to see me for her back, and she rides in North London for the lady who's got the £170,000 show jumper. If you flick through the pictures, I think onto the second page, you see the picture of her actually facing you. Now, if you look at the green lines, you can see that is where her posture should be. And looking at her from the front, she's in pretty good shape. Essentially shoulders and pelvis, knees and ankles are all level. But then if you flick onto the next page and you look at her from the side, things are a bit different. So again, you've got the green line, which is what she should be, but the red line is what she actually is. I'm sorry. Yeah. Okay, yeah. Okay, the straight line's where she should be. So you can see how far her head is forward. Now, yeah, I've actually videoed her riding a couple of times, and it's strange for someone who rides at that level, and probably the best way I can describe it is she looks to me like she's in an armchair. She's kind of like this, and I'm like, that's so wrong. Anyway.
And a lot of your weight is in the head.
Absolutely.
Huge amount.
Absolutely. So you bring that forward, and where's it going? It's going down through the withers. Your horse is already 60-40 front to back, so you add 10 kilos, and that's it. It's downhill. So you've got a dressage horse that can't do dressage, and a jumping horse that knocks poles. Okay, what are we on to now? Right, I think that's probably the end of your programme, but it's not quite the end of my talking. I'm nearly done. Right, so what's going to happen now is I want to... No, not yet. I want to try and talk you through a little bit of what happens in an actual examination, so really with the anatomy. So a combination of the anatomy and the examination. So I always start with observation, and this occurs as soon as I meet the horse. So not so much I go up and shake her hand, but I go and speak to the owner, because I normally take the case history in the stable. So we're just standing there and we've got the horse there. I want to see how it stands. Does it rest on one leg? What's its demeanour? Does it seem approachable? I might have found out some of this from conversations with the vet, the farrier, the dentist or the saddler beforehand, but like to make my own mind up anyway. Then generally we get the horse out the stable and walk it out to either a manage that's not too deep. This surface actually looks quite good. I prefer to do it on hard ground, so here I normally run up and down the outside yard or up where the farrier goes. Sorry, I can't quite read my notes. My eyesight's not great. Right, so this initial part is known as the active examination and consists of seeing the horse initially in walk. And I have quite a routine that I go through. So I get them to walk up, walk away from me and back towards me 3 times. Trot up and towards me 3 times, and then do small circles on both reins. So these small circles will actually just be around me. Sometimes when I go out and I'm seeing a horse with a vet, vets like to see horses lunged. The lunging is of less importance to me. I occasionally see a horse ridden, and I will often look at its saddle. But the ridden aspect only really comes in when I'm doing the horse and rider video analysis. So I observe initially from the back as the horse moves away, but I often then move side to side to see how its shoulders and its pelvis move. Some of the things I'm looking for are symmetry at the ear, the shoulder and the pelvis, length of stride, differences in muscle tone, any obvious pain, discomfort, lameness, range and quality of movement. Now, range of movement is how far something moves. Quality of movement is how well it moves. So an analogy there is if you open one of the doors in your house, most doors swing quite loosely. So they'd swing from here to here. So that's its range of movement. Quality of movement is how well it does it. Do you have to kick that door to get it to move, or do you just touch it and it's nice and gentle? Right. Then I have a walk around the horse, looking for any abnormalities or obvious asymmetry. I start with a palpatory exam, so I then tend to run my hand all over the horse, along its back, over its shoulders, up and down its forelimbs, looking for any lumps, bumps, changes in temperature, pain, discomfort. I then move on to the passive examination. Passive examination is when I actually pick joints up and I put them through a range of movement to see how well they function. I tend to start at the front, so with the front limbs, and then move to the hind limbs. I then go from the top of the neck, so the occipital joint, and finish at the lumbosacral joint. So if we start at the bottom of the foreleg, we're looking at P2-3 and the navicular, so the coffin. We then got P1-2, which are the first and second phalanxes at the pastern. Up to the knee. The knee's got 8 bones, which is essentially the radius on the cannon, which is the third metacarpal. You've then got the splints on either side, which are the second and fourth metacarpals. On top, you've got the radial carpal, the intermediate carpal, the ulnar carpal, and the accessory carpal. On the bottom, you've got the first carpal when it's present, the second, third, and fourth carpal bones. Up at the elbow, you've got the articulation between the humerus above and the radius and the ulna below. Then the shoulder joint links the humerus and the scapula at the glenoid cavity. If we move on to the hind limbs, so we've got P2-3 in the navicular to the coffin, P1-2 pastern, then the hock. The hock is the tibia and the metatarsal bones. The top is the calcaneus and the talus on top. The central tarsal, the third tarsal, the first and second tarsals which are fused, and the fourth tarsal, which will all rest atop the metatarsals. Up to the stifle. Stifle is made up of the tibia, the femur, with the patella, so that's the equivalent of here in us. Hip is the upper end of the femur into the sockets of the hip bone, and then we're on to the spine. Now, the spine in the horse is quite similar to the spine in a human, just that they have more vertebrae than we do. So the human spine and the equine spine, equine cervical spine, i.e. neck, both have 7 cervical vertebrae. Our neck is a very mobile part of our spine. We can do flexion, extension, side bending and rotation. Horses can do most of those movements to a degree. You'll find your horse can get its head almost around to its tail. If we then move on to the thoracic spine, so the bit in the middle, in us we've got 12 vertebrae and 12 pairs of ribs. In a horse you've got 18. Some breeds that I think there's only 16. I think it's Arabs have only got 16. But there's a couple of breeds which actually have less thoracic vertebrae than the standard 18. We then move on to the lumbar spine, i.e. the low back. So in us, we've got 5 lumbar vertebrae. Horses have got 6. Now, the joints in the lumbar spine are a little bit different to the joints in the human lumbar spine. In our spine, the joints rub against each other like that. In the equine lumbar spine, they're actually more like this. So there's not a great deal of movement in the lumbar spine. It's more of a twist and a rotation. We then move on to the sacrum here. This is 5 fused vertebrae. We have 5, they have 5. Then the coccyx. Now the coccyx is this bone right at the bottom in us. It's 2 little bones. But in a horse it's between 15 and 22, and that is what makes up the tail. Okay. So... I don't know. I don't generally count them, but I don't know. Maybe tonight we can have a count, see how many we can get. So, when I've gone through this part of the examination, the general things I'm looking for are range and quality of movement and symmetry. because the first time I see a horse move, I'm normally looking at it from behind, my eye is naturally drawn to the pelvis. And my personal feeling is that a lot of issues come from the pelvis. They certainly do in people. If a person is out of alignment in their pelvis, then they're out of alignment all the way up. And you see a similar thing with horses. Perhaps if we can get a horse out now, I can then talk you through what I actually do. You might want to come in. You could all stay there just so that my video camera doesn't get you all in. But yeah, I'll come in. Okay, I've seen Derek before, but I can't actually remember a great deal about him because it was about 3 weeks ago, possibly 4. But I've said to a couple of you, I actually left my notes for him at home, and I can't look at them, so we need to almost just go through this again. So if you imagine that I've already taken the case history, and we're going to start with the examination. So if you could just move it up the centre line, and I'll give you a shout when to turn around. Okay, back. Okay, this end you turn left when you go back up again. Okay, so there's quite a lot of clicking coming from his back end. The correct term for that is crepitus, and it's normally due to a joint being tight.
Can you talk up a bit, sorry, shout a lot.
And back. There's quite a lot of clicking coming from his joints. Now, the correct term for that is crepitus. It can be due to wear and tear in the joint, but is often due to just tightness in the muscles and in the tendons which cover the joint. If he's been in this stable, and again, please, if he's been in this stable for the last 6 hours, it's like any of us spending 6 hours on the sofa and getting up and being asked to do some exercise. So at the moment, what I'm looking for is, I said symmetry. The first thing my eye is drawn to is his pelvis. And back. His pelvis is actually higher on the right than the left. Now, in an ideal world, your pelvis would be completely level. That's the ideal world, though. In the real world, most of us and most horses are a bit wonky. So, although I'm seeing that, at the moment it doesn't mean a great deal. Just once more up and back, please. Only goes back as far as the beginning line. The stride length is fairly equal, and back. The quality of movement of the hips and the pelvis isn't great. It's okay. If you can now do trot, please. Okay, so what I'm looking for here in the pelvis is an actual rise and fall equally, forwards and backwards rotation equally. Just keep going up and down. So you see now it's different in the trot to how it is in the walk. The pelvic levels, also as the tuber sacralum, are actually level around you to the left. You stay in the middle. He's going to move forward and around you. Okay? Fine. So what I'm looking for here is I'm looking for basically how much bend is there through his neck and his top line. So his thoracic and his lumbar spine, and how well does he cross his hind leg underneath. So far it's okay. He's a little bit stiff across his pelvis, but not too bad. Okay, swap sides and do it the other way. Okay, now you see this is a bit different this side. The crossing is still going on. That's fine, I'll just stop. But the movement seems to be stopping just behind the saddle. So that's approximately the thoracolumbar junction, which is the junction between the middle of his back and his lower back. So, last thing, I've now get him to do some rein back because I want to see how well his pelvis actually moves. So if you can walk him on half a dozen strides, and then rein him back half a dozen strides. That's fine, and on again. And back again. Okay, so I'm looking for length of stride behind and any deviation laterally. Okay, forward again. And back again. Okay, so his rein back is not too bad. It's not brilliant, but it's not too bad. So that's the active examination done. Now I'll move on to a passive examination. You might want to come a little bit closer for this. Is he okay with people? Yeah. Or not. I think he's generally been okay with me in the past. I'm treating him as a new horse. Okay, so the musculoskeletal things we were talking about earlier, this is what I'm really looking for now. Lumps, bumps, pain, tenderness, swelling. All right, mate, put it down. Okay, so really nothing of any significance there. Now I'll start with the passive examination. So, start at the bottom. Remember, I'm looking for range and quality of movement. No preferences. Superficial reflex tendons. Pretty good. Come up to the carpal bones. And this is the wrist in us. Yep, they all function pretty well. Elbow. Shoulder. I always compare one side to the other. If I've got an inkling that there's a problem wrong on one side, I tend to start with the good side saw with him walking. The over there. Okay, then we move to the back. So, same thing here, we put the joints through a range of movement. Whilst palpating. So I've gone fetlock, I've gone hop in range, I've hit stifle, hip, or pelvis. So far so good.
So that looks quite good.
Yeah.
That looked like a lot of good movement.
Yeah, it's pretty good. I mean, it's a little bit tight at the end, but that's fairly normal. Right, new round, right? Okay, so same thing. Rotating tendons, assessing the fetlock, hop, hop range of movement is okay.
Not quite so much that side.
Stifle, yeah,
Hip.
pelvis. Yeah, now you see this is different. I don't know if you can see that, or maybe I'm getting tired, but what I want to see is I want his pelvis to move up and down like that, and I want forwards and backwards rotation in it. So if we go back to the left,
It was the up and down that wasn't so good, wasn't it?
Yeah.
Yeah.
okay, so I've taken each joint to its end range of movement, okay, and you can see, hopefully, that there's some give through the pelvis due to sacroiliac and onto the bottom of the lumbar spine. Right. But it's different.
Yeah. This doesn't work.
You see, I can force it,
Yeah.
but I don't want to force it. So my feeling so far is that the issue is around the sacroiliac joint and the bottom of the pelvis. Then I come to the top of the horse. And I start with the temporomandibular joint, which is the jaw, essentially. So I move side to side. Hand in. All good so far. Come up to the occiput, the occipital joint. Okay. Alright, some horses are a bit head shy, so you just have to do it a little bit differently. Let's just cheat. There's nothing in there. We just take it over. Clear now. Okay, so I'm just palpating down the cervical spine at the moment. Just a bit of a general movement to see is there some give through each vertebrae? Is there any obvious tenderness? Feels a little bit tight towards the top of his neck. That might be the fact that you're all standing there or wants his dinner. Seems a bit more noticeable on the left than the right. The right seems okay. So then I move on to the thoracic spine. So starting at the withers, run my fingers along this thoracic spine, looking for any obvious reaction. Seems to
That
say.
could be a muscle reaction.
Could be, absolutely, yeah.
And is that okay to see them not flinch but flex?
Yeah, completely. You want movement.
Yeah.
Movement is the way forward. I'm only really concerned thoracic spine, okay? I then check the ribs. Now, I don't know if any of you have seen the skeleton of a horse, but what you touch along here are the tips of the spinous processes. Now, each vertebrae is essentially a block, and it has a figure a little bit like this, called the spinous process, and then either side are transverse processes. Sorry. At the withers, the spinous process is almost a foot long. Okay? So at the withers, you've got to come down near your foot onto your hip and ribs. So I'm assessing the ribs, and then the intercostals, which are the muscles in between the ribs. So far. Okay, now move on to the lumbar spine. So I find the last lumbar vertebrae. I use this tail to help me, and I'm just getting an idea of the mobility in its low back. Flexing the spine. Okay, but then right is a little bit tighter. It might be due to the way he's standing. It's not completely square. But yeah. Going on with that reaction and the stiffness in his pelvis, this is where I'll be focusing on treatment. So I'm not going to treat him today because he had some treatment recently. I think he's on a treatment plan with me. But what I would do, I would generally start with some soft tissue work to the erector spinae, quadratus lumborum, and the gluteals. So essentially this local area. I then do some stretching of the lumbar spine, low thoracic spine, and possibly manipulate its pelvis. So to manipulate its pelvis, I can't really explain it without doing it, and I don't want to do that now. You basically pick the leg up and you put a force through the pelvis. So yeah, so that's one horse.
How strong do you have to be to manipulate a horse's pelvis?
At the end of the day,
Do you want another horse?
please, yeah. Should we have Sarah?
Yeah.
If I see about 10 or 12 horses in a day, if I see more than 10 or 12 horses in a day, I can't really move in the evening.
Do you need treatment then after that sort of
Yeah.
work?
Yeah, completely. I tore my hamstring running, and now my pelvis is a bit wonky, so I'm really careful with the manipulation because, again, at the end of the day, I come off a bit like an old man. Did you follow me, or did I lose you?
What sort of thing when you said you stretched the spine? That looks helpful.
It is, yeah. A little difficult because I don't really want to treat Eric because Eric's on a treatment plan with me at the moment. Certainly, if you want to have a look on my website, there are pictures of me treating, or if you want to come up and watch me treating some of the horses up here, I think I'm asking this lady's horse in the business, so I'm not, if she's happy with that, obviously we'll just check with her. Sarah, who we're going to see next, I treated 2 days ago, and I won't give any treatment to her today either. So I'm sorry I can't show you that. That's the bit you have to do, make some effort, come and spend some time with me.
You can explain it digitally.
Yeah. works for me, I don't know if it works for every osteopath or physio, is I treat what I find and then I leave it alone. Yeah, probably.
How many treatments would you need to help their pelvic level out?
Without looking over his case history, I can't tell you.
On an estimate.
How long has been spring?
Yeah.
How long has he had it? I think he's a relatively young horse, so that's quite a good sign. Yeah. But if he's had the issue for, let's say, 6 months, I've got a feeling he has had issues for a long time. You're probably looking at seeing him on a monthly basis for a few months, and then 2 monthly, and then probably 3 monthly. So a number of sessions, maybe 6, but that's going to take time to do it. I can't wave a wand. Cool. No, I just got fed up with getting grease under my fingernails, so it's just a bit vain, really. Okay.
Thank you very much for bringing Derek.
Thanks. James, get in the other one, yeah. Yeah, I mean...
You probably hear that a lot. The click doesn't... It's there, isn't it?
It's meant to be naturally, that's the joy. There is research done on it, but I think until they dissect someone at the same time as manipulating, they're not 100% sure. It's actually the bones being pulled apart rather than the bones rubbing against each other. So you'll see and feel almost immediate relief. If the horse can say then to its right beforehand, and you manipulate it, suddenly they'll go. You need really reassuring.
I had that feeling I wanted to show you.
Yeah.
I say tremor, and you're always told, do that, and you're always told, don't kick the fingers because you get arthritis.
It changed a lot.
Sarah?
Wonderful. So I saw Sarah a couple of days ago, and I can't remember her case history, I'm afraid, and I can't get her notes either. But she's been off lane for, I think 6 months or so, possibly longer. The vet been up, I think she's had nerve blocks in one of her forelimbs.
Left four.
Yeah, in the left paw. And again in the ankles. What do any of you see in this now? Popular colour. And that. Do you think her pelvis is level? again. Okay, and back. That's fine. Okay, so although there's a little bit of deviation both ways, it doesn't really concern me because it's not marked to the left or marked to the right. It's what you would expect. So now again, I come on for the examination. So because my eye was drawn to the left four, I have to start with the right. Okay, we just go through the basic outline of the examination. So I run my hands over, a little very weak, swelling, muscle, bone, asymmetry, symmetry, tenderness. She's a little bit tight through, well, from above the hip up to the pelvis. Just give her a full spine. Which is a joint right at the top of her neck, is also quite tight. Impingement associated with headaches. I don't know if there is any research or if there is any evidence of horses getting headaches, but the anatomy is pretty similar at the top of the equine spine as it is in humans, so I see no reason why she can't have a headache. Really tight on her neck. We're done. We're done.
Thank you, Jane, very much for ringing Sarah. Appreciate it.
Thanks, Jane. What's it? Is there anything else I can answer?
I think we can have that, Sarah, eventually.
Is there anything else? Anybody got any more questions?
Yeah, I think interesting to sort of know what length of plan you think would help both of you. I know you can't say specifically, but you might say I would expect to treat this sort of condition would take 3 months to 6 months, or this sort of condition would take 6 months to a year. Do you have any feeling for that either horse? You know, if you, in your ideal world, that you could treat it to your specification.
Therapy's ongoing,
Yeah.
but can carry on doing pretty much what his job is. Sarah, I think you're looking at 3 to 6 months to get her back to a normal, but she needs to be on low-level work. Yeah.
Say like the really low together, the really acceptable, but this is the nature of its job.
Yeah.
You have to do what that example do. It basically requires more cafe in order to continue its journey. It has to have the every day.
I go to this lady courses. I'm there every month, and I have been for the past 4 or 5 months. She fortunately understands how important my job is as sort of like part of the team. But then, you know, I went out this morning and I saw a guy's horse, and all he really wants from it is to hack it, and it had a couple of issues in its back, but it's then unnecessary for me to just to fix it completely.
Because he's not going to develop this problem.
He doesn't need to spend the money on it, you know, a bit of a tweak. Yeah, so I ended up saying to him, I'll see you in 6 months. Yeah.
It's an athlete.
I think you do have to relate it to an athlete. If you think of any athlete doing any sport at a high level, then, I mean, you think of Charlotte Jacques, she goes to the gym 3 times or 4 times a week and works out with the trainer. That's her physio, what we call it one-way physio. And I dare say the horses have people come to see regularly because they're high-performing athletes. I think a high-performing athlete will be looking after their well-being as best she can, and will be a really good horse.
I think that's what it's down to for a lot of people that actually do it.
I know there's horses that aren't like super, so you have to decide the effort that you
The
how
things you've told me about your ankle, I'll probably be saying, you know, you really want your horse better, you need to be busy, you need to be with it, and you need to have some treatment. You know, often people only treat one side of it, so they treat their horse, but they then forget about themselves. And that's the information.
Are there any sort of just generic exercises that you recommend for horse life that people just kind of
Generally to do these things are a good idea. So carrot stretches are classically one of the. Would you generally
Yeah, there are. I'll tell you what, did you all fill in your name and mobile email?
Not
Okay.
mobile.
There was a bit of paper that was sent out. Put your mobile and email on there, and I'll either email you or WhatsApp you some basic exercises that you can do for yourself and your horse. I mean, probably.
Even more important for other people. As you know, James and I, we need to actually do horse fitness.
Yeah, so please do that, and I'll